You're about to hear something that most people never will. Not because it's hidden in secret files or buried in medical textbooks, but because almost no doctor will say these things out loud, especially not to the people who deserve honesty the most: older adults. Behind the polite greetings and neatly pressed lab coats, there are quiet beliefs, subtle biases, and unspoken assumptions that shape how seniors are treated every single day. Some of them are practical, some are deeply flawed, and some are simply I've seen these patterns up close. In exam rooms, in hospital hallways, in late-night conversations with exhausted medical staff. And once you understand these 5 hard truths, you'll never walk into a doctor's office the same way because this isn't just about healthcare. It's about respect, dignity, and the basic right to be treated as someone whose life still matters, fully, completely, and without hesitation. Let's begin. Hard truth number 5. Many doctors see older patients as too complicated. The moment an older patient walks through the door, some doctors make a silent calculation, one they'll never admit publicly. How long is this going to take? How many conditions are we dealing with? How many medications? And how much will I realistically be able to fix? That quick, subtle judgment sets the tone for everything that follows. Older adults often have a long history of medical experiences: high blood pressure, arthritis, diabetes, stomach issues, old injuries, medications that interact, symptoms that overlap, and new problems just beginning to surface. None of this is unusual. None of it is your fault. It's just life. But to a rushed doctor juggling a packed schedule, that complexity doesn't always look like a human story. Sometimes it looks like a mountain of work, a puzzle with too many pieces, a case with no solution. And in a healthcare system that rewards quick decisions and high turnover, complicated patients get mentally flagged, even if the doctor doesn't realize it. Research backs this up. Older adults with multiple conditions are routinely misdiagnosed at nearly double the rate of middle-aged patients. Not because their symptoms are mysterious, but because doctors sometimes default to the most convenient explanation instead of the most accurate one. Let me share a story that illustrates this perfectly. A man named Harold, 72, came into his appointment complaining of back pain, fatigue, and difficulty sleeping. The doctor, juggling several other urgent cases, quickly assumed it was normal aging, handed him muscle relaxers, and sent him home with a device to rest. Weeks later, Harold collapsed during a morning walk. The real cause? A kidney condition that had been silently progressing for months. One that would have been detected earlier if the doctor had taken the time to dig deeper instead of settling for the quickest answer. This is the quiet cost of being labeled too complicated. Treatments get delayed. Serious problem, MS, get overlooked. And seniors are left feeling ignored, even when the signs were right there in front of everyone. And here's the twist. Complexity isn't a problem. It's normal. It's expected. And it's something a good doctor should be willing to manage with patience, expertise, and respect. But complexity is only the first hard truth, and it's far from the most unsettling. Because even when a doctor fully understands your conditions, they may still assume something that affects the care you receive next. Hard truth number 4. Some doctors quietly assume seniors won't follow treatment plans. There's a belief circulating through many clinics, whispered in break rooms and scribbled quietly in medical charts. Seniors don't stick to their treatment plans. It's not always said harshly. Sometimes it sounds sympathetic. Oh, they probably just forgot. Oh, they're overwhelmed. Oh, the meds are too expensive. But the assumption is here. And that assumption changes how doctors treat older adults. When a doctor believes a patient won't follow through, they're less likely to recommend advanced treatments. They may skip over the rapies. They may choose a weaker medication, thinking, at least they'll tolerate is one. They may avoid procedures that require careful aftercare. In other words, the doctor adjusts expectations downward, not because of your ability or your intelligence, but because of an assumption. And assumptions can be dangerous. Let's look at a real-world example. Maria, 69, was prescribed a medication for her blood pressure. It made her feel dizzy, so she stopped taking it. But she didn't tell her doctor. She didn't want to be lectured. She didn't want to seem difficult. At her follow-up, the doctor saw her blood pressure hadn't improved. But instead of asking questions, he assumed she'd been inconsistent, so he doubled the dose. Within days, Maria was in the ER after fainting. In her kitchen, her silence and his assumption created a perfect storm. And here's the important part. Medication challenge. Guess are common. Side effects are real. Costs add up. Schedules get confusing. None of that makes you non-compliant. It makes you human. But the label, once it appears in your chart, can follow you from doctor to doctor, influencing every future appointment. And that quiet, unspoken bias sets the stage for a third hard truth, one that affects nearly every senior, even the most responsible ones. Hard truth number 3, doctors believe seniors hide symptoms. This is one of the most consistent frustrations doctors talk about behind closed doors. Older adults often keep things to themselves, not intentionally, not recklessly, often out of fear, politeness, or not wanting to bother anyone. But the result is the same. Symptoms go unmentioned until they become impossible to ignore. A surprising number of seniors admit they hide symptoms like nighttime chest pressure, tingling in hands or feet, frequent dizziness, unexplained fatigue, shortness of breath, memory lapses, changes in appetite, sleep problems. Why? Because they don't want to seem dramatic, or burdensome, or old. Some fear being told they can't live alone anymore. Others don't want to hear another round of tests, pills, or lifestyle changes. And many simply don't want to take up more time during a rushed appointment. But when doctors notice missing details, they begin to assume that seniors always hide things. That assumption chips away at trust. And when trust drops, curiosity drops. Doctors stop asking deeper questions. EY takes symptoms at face value. They jump to conclusions. A senior who hides symptoms, even once, may unknowingly reinforce a stereotype that follows them for years. Let's look at a clear example. A woman named Ruth, 75, told her doctor she was doing fine, except for mild fatigue. She didn't mention the shortness of breath when climbing stairs. She didn't mention the tightness she felt at night. She didn't mention the swelling in her ankles. I don't want to be dramatic, she later told her niece. Her doctor ordered basic labs. Everything came back normal. 2 weeks later, Ruth collapsed while grocery shopping. She had been in early heart failure, something that would have been discovered earlier if she'd shared one of those symptoms. Now, it's important to understand. Ruth didn't hide these symptoms out of neglect. She hid them out of fear. Fear of what they meant, fear of being judged, fear of appearing weak. Millions of seniors do the same. And doctors know it. They've seen it too often. But even when seniors tell the truth, and even when doctors believe them, another barrier still stands in the way. Hard truth number 2. Doctors are under extreme pressure, and seniors take the longest. If you've ever felt rushed during an appointment, you're not imagining it. Most primary care visits in the U.S. last around 18 minutes for everything. 18 minutes to discuss symptoms, ask questions, be examined, get prescriptions, review medications, K about test results and plan next steps. And seniors, with naturally more complex medical needs, almost always need more than 18 minutes. But the clock doesn't care, and the schedule doesn't bend. Doctors are often triple booked, overworked, and backed up from the moment they arrive. And when time is tight, who gets shortchanged? The patient who speaks slower, asks more questions, ings more medications, and has more concerns. In other words, seniors. This isn't because doctors don't care. It's because the system pushes them into rush decisions. Let's imagine a typical scenario. A senior named Martin arrives for his checkup. He has a list of symptoms: trouble sleeping, occasional chest pressure, swelling in one ankle, indigestion, and side effects from a new medication. He also brings 5 pill bottles for review. To address all of this properly would take at least 30 to 40 minutes. But the Octa has 18, so decisions are made quickly. Questions get ignored. Test options are skipped. And the visit becomes focused on the single most obvious issue. Sometimes that's enough, but sometimes it's not. Shorter visits with seniors are strongly linked to misdiagnosis, delayed diagnosis, and preventable complications. It's not because older adults are difficult. It's because older adults deserve more time. And the system doesn't always allow doctors to give it. But this final truth, the last one, goes deeper than any scheduling issue. It reaches into the heart of how medical decisions are made. And it's the most important truth of all. Hard truth number 1. Age bias is real, and it changes the care seniors receive. This is the hardest truth to hear, and the one most people never talk about openly. Age bias in medicine is real. Subtle, quiet, but real. Even when doctors don't intend harm, age can influence the decisions they make about tests, treatments, referrals, and even life-saving interventions. Not because older adults can't benefit from treatment, and not because procedures don't work in old age, but because some doctors assume the return on investment is lower for seniors. It sounds harsh because it is. Here's what age bias can look like in everyday medical care. A senior with chest pain gets basic tests instead of advanced imaging. A senior with aggressive cancer is told about comfort care instead of clinical trials. A senior with a treatable condition is told, it's just a jing. A senior in the ER waits longer for interventions younger patients get immediately. The outcome: delayed treatment, reduced options, HIG, her risk, and worse results. But here's the truth backed by scientific evidence. Most treatments work just as well at 65, 75, or 85 as they do at 45. Stents still open arteries. Heart medications still save lives. Surgeries still restore function. Therapies still prevent decline. Age is not the limiting factor. Biases. One story stands out clearly. A woman named Lillian, 80, arrived at the hospital after fainting in her yard. Her vital signs were concerning. Her family was frightened, but the staff made a quiet assumption, one they would never say out loud. She's older. It's probably nothing fixable. Instead of sending her for immediate imaging, she was monitored and sent home. Days later, she suffered a major stroke caused by an issue that could have been detected earlier. Was her age the reason she didn't get the same urgency as a younger patient? Her family believes so, and they're not alone. Thousands of seniors and families tell similar stories every year. Age bias is real, but here's the part that matters. Once you know it exists, you see and push back against it. And that's where your power begins. The real takeaway: awareness is your strongest defense. We've uncovered 5 hard truths today, truths that shape how seniors are treated in ways most people never realize. Many doctors see senior RS as too complicated. Some quietly assume older adults won't follow treatments. Doctors believe seniors hide symptoms. Time pressure pushes seniors to the back of the line. Age bias is real and influences medical decisions. These truths aren't meant to scare you. EYRE meant to equip you. When you understand what's happening behind the scenes, you walk into appointments differently. You ask the extra question. You bring a notepad. You rep. Eat your concerns if needed. You insist on explanations. You request second opinions. You refuse to be brushed aside with vague answers or quick assumptions. Because your life is not a footnote. Our story is not an inconvenience. Your age is not a reason to receive anything less than thoughtful, thorough, respectful medical care. You deserve the same urgency, the same attention, and the same determination that a New York younger patient would receive. And when you advocate for yourself, when you stand firm, you force the system to treat you as the person you are, not the stereotype it expects. So here's the question I want you to answer. Not for me, but for yourself. What is the one promise you will make to protect your health from this moment forward? Will you speak up more boldly? Will you bring a trusted person with you to appointment? Will you keep a list of symptoms? Will you ask for explanations when something feels unclear? Will you push B? Act when something doesn't sound right. Choose one, just one, and write it down below. Your promise might be the same one someone else needs the courage to make today. If this message helped you, give the video a like. It truly helps us reach more seniors who need this knowledge. And if you want more honest, empowering explanations like this one, hit subscribe so you never miss what comes next. Before you go, think of one person, a friend, a neighbor, or a family member who needs to hear this. Share it with them. You might change their life. Thank you for spending this time with me. Stay strong, stay informed, and stay confident in the value of your life and your health. Because you matter more than any age, any diagnosis, or any assumption could ever define. I'll see you in the next video.